Hello everyone, it's my honor to introduce our work on developing the vessel wall imaging of intracranial perforating arteries with 0.3 mm isotropic resolution at 70. I am Zhang from Institute of Biophysics, Chinese Academy of Sciences, Beijing, China. To begin with my talk, let's look at the lenticulostriate artery. It's a kind of small vessel that supplies blood to basal ganglia. Its impairment will cause lacunar infarction, but imaging LSA is very challenging because of its small caliber. In the past, MR angiography at 70 was able to show its flow. However, we hope to depict its vessel wall in a finer way. For the vessel wall imaging, 3D turbo spin echo is a broadly used technique. 70 MRI provides even higher SNR and can potentially improve the resolution further. So, in our study, our purpose is to develop an inner volume 3D TSE sequence for the vessel wall imaging of LSAs with 0.3 mm isotropic resolution in 10 minutes. For this purpose, we need to improve the resolution while limiting the acquisition matrix. Therefore, we designed an inner volume excitation covering LSA territory only. In the IV space, a 2D RF pulse is designed and optimized for 90-degree excitation. In the pulse design, we adopted a spiral-in transmit K-space trajectory. To overcome the field inhomogeneity in ultra-high field, the B0 and B1 maps were incorporated to the pulse design with the phase constraint of CPMG condition. Here are our results. In the left figure, the better performance of our 2D RF pulse is demonstrated. Better background suppression and alleviated aliasing artifacts can be easily identified. In the right figure, we show the superiority of IV space with 0.3 mm isotropic voxels on displaying LSA. Because of the small acquisition matrix, the K-space center was oversampled so that higher SNR can be achieved. It guaranteed more smooth and continuous delineation of LSA. Finally, when analyzing the section of vessel wall, IV space exhibited higher contrast in showing the wall and the lumen of LSA. So, in conclusion, our results demonstrate the superiority of IV space in displaying the wall and the lumen of LSA. In the future, the workflow for field maps acquisition and pulse design will be optimized for fast scan on patients, and the clinical implication of this technique on small vessel disease will also be explored. That's my presentation. Thanks for your attention.